Good morning. I'm Jessica Lovell, and welcome to the Morning Medical Update. 4 years ago this week, the University of Kansas Health System admitted its very first COVID-19 patient. Soon after that, local governments issued stay-at-home orders. Schools moved online. We learned which jobs were considered essential and how distant 6 feet apart can really feel. The health system also started this program you are watching in order to update the public on the rapidly changing pandemic. After 4 years, it can feel like we're past the pandemic, but that back to normal narrative can often ignore the mental and emotional toll it took. And it's not just a toll on each of us individually. We experience what's called a collective trauma. That is the phrase used in the latest report from the American Psychological Association. Their annual Stress in America survey reached more than 3,000 adults and found a significant increase in reported mental health conditions and chronic illnesses. To help us understand more and process some of this trauma, we are joined by 2 members of the American Psychological Association, both working here at the health system, Doctors Greg Nowalnik and Danielle Johnson. Good morning to both of you. Dr. Nowalnik is a clinical psychologist and Dr. Johnson is a pediatric psychologist. And I think I can speak for both of you when we say a pandemic kind of hurt our collective mental health. You both were on our show and program many, many times talking about the ever-changing pandemic and the toll it took on us. But we're talking also with Dr. Hawkinson today because we know that this took a major toll on the frontline workers. Dr. Hawkinson is out at Olathe this morning. Good to see you. It's been 4 years that we've been meeting like this.
Yeah, great. Thank you. Yes, I'm down here at the very lovely Olathe campus right now. It's been 4 years. It seems like longer in some circumstances, and it seems like less in other circumstances. Again, I think we almost talk about it. It's like that blip from the Marvel movies and the Avengers movies when it's almost like 3 or 4 years out of people's history that seems like it went by really fast, but it didn't go that fast. It was a day-to-day process for a very long time, affected many, many people on many different levels.
Yeah, that's a really good way of putting it, Hawk. We look forward to visiting with you more about this and kind of going back in time over the last 4 years with you this morning. Dr. Nowalnik, what does the phrase collective trauma mean? And does it apply to all of us?
Well, so collective trauma is just a means of differentiating between, an individual can experience a traumatic situation, and that individual exists in a family system, then they also exist in their social and larger world. So collective trauma is just referring to the size of the impact. So it's not that this happened to 1 or 2 individuals. This is a socially and culturally impactful event.
It's something that impacted everyone, but maybe at different levels of stress and mental health toll. But one of the interesting things about this report was that 80% of the people said that overall, they feel healthy, but when they answered more and more questions, they really drilled it down. Many people acknowledged that they were dealing with anxiety and depression and chronic conditions like high blood pressure. So do you think that people might not be acknowledging their own stress properly?
I mean, I think on a superficial level, when you ask people how they're doing, they're kind of conditioned to say, yeah, I'm fine. Like if you pass anybody in the hall, hey, how you doing? Fine. It's once you actually start asking about specific things, you start to realize like, wow, yeah, maybe I'm actually not doing so great. So it's not super surprising that there's a superficial kind of veneer of wellness, and then once you actually start to pick on specific things, you start to see those kind of flex points.
Are you saying that when people say, how are you, you just say, yeah, I'm fine, because you're thinking no one really wants to know how you're doing. And
Yeah.
Stress is a word we throw around really easily, right?
100%.
So, Dr. Johnson, how did the shift in remote learning impact kids mentally? All 3 of us have young children, and that was a big thing. We put almost like our kids' well-being way before ours, and I know that's how it was for many parents out there. What was the impact, do you think?
The impact we're still feeling in 2024. It's not shocking. I had a kid last week at Marillac who the mom reported that their kid is still struggling from the aftermath of going to online learning. And so for different school districts, they were online a lot longer than others. I can say for our school district, we were online for the school year ended 2020, March. But by September, our school district was back in person. We were masked and 6 feet apart and social distancing, but they were back in session. I know there were many school districts in the Kansas City area they weren't back for 9 to 12 months. And so the longer those kids were out of school, the more difficult those kids transition back to in school. And some kids have not transitioned back to in school. And so the rates of absenteeism, truancy, and dropouts has increased since COVID happened. And so we know that the impact of online learning, while for some kids was a blessing and a godsend because those kids struggled in person due to other pre-existing mental health conditions, some of those kids did well online, but the vast majority of kids did not transition very nicely to the online platform.
Well, and you got K to 12. I mean,
Correct.
You got little tiny kids all the way up to adults dealing
Yeah.
with different issues at different stages in their life. Do you think that it affected early childhood development academically and socially?
We've got some studies, they've done some really good studies out of Japan actually that had some pre and post COVID tracking for the ages and stages questionnaire, and that looks at social, emotional, gross motor, fine motor development, and that goes from I think 1 month to 5 years old. And so they're able to compare pre and post COVID and found some losses, not that it was a widespread event, but those kids scored lower on developmental questionnaires at a very early age, around 2 and 3, they could see some differences in development. We know for older kids, there were some social losses as well. Kids that don't have full access to Wi-Fi, so we think of our super urban kids, super rural kids, where Wi-Fi can be spotty or access to some of those resources is spotty, they weren't as socially connected. So they had some losses in social relationships. Those kids whose parents have a higher SES, of course, did the best because they had more resources. Not to say that all of those kids did, beautifully well. They did better just because they had more financial resources to buffer some of the impacts of COVID, such as parents losing jobs or parents being sick and not having health insurance or enough health insurance. And so those kids really struggled that had less social means.
Of course, we also want to acknowledge the stress and trauma that happened here at the health system and health systems across the country, especially up there on the COVID ICU units. Dr. Hawkinson, there's a baseline amount of stress in any hospital setting. They're suffering, difficult decisions to make, lots of pressure. How did COVID worsen all of that?
Yeah, I think on the global scale, meaning that, COVID did certainly increase and make more blatant and obvious the health disparities of individual groups, individual people, for sure. If we're talking about in the hospital, in the health system itself, we saw our coworkers who were dealing with patients on a day-to-day basis. Many, many times it remained professional, and it was a job that people were going to every day, or they felt a purpose to be going to every day to treat these people that were coming in, that were ill, that we had no good treatments, no good preventive measures to help with. And then once they got home, and you hear stories about this, once they're able to decompress, it allowed those thoughts and those feelings to set in of somewhat of hopelessness and depression, but still working through it every day to show up to the job, to help those people that needed it most. And that is what is so vitally important. And we saw in our community and in communities around the country and in really communities around the world, health workers, frontline workers going to work every day, understanding they are at risk of getting this disease, but still putting their health, their safety, their lives on the line to treat those people that really needed it most at that point in time.
And so many low moments, especially those heart-wrenching situations where someone was dying. Their families had to say goodbye through a phone or an iPad. Hawk, for you personally, what was your lowest low that you remember?
Yeah, I think that my story is not necessarily different than a lot of people's stories. It is being asked, okay, I have this disease, you told me I have this diagnosis, what can you do for me? And in this case, and in particular for one patient that I do remember, she came from a nursing facility, and this was early on when there was nursing facility outbreaks in our community. And that was a very direct question to me. What can you do for me? How can you help me? And my answer, unfortunately, was, well, there's not much that I can do. We can give you supportive care. We'll give you oxygen. We'll give you, pain medication if you need it. But we just have to ride this thing through. Unfortunately, she did end up passing away. And I think that was the story for a lot of people, a lot of providers, whether it's physicians, the nurses, the respiratory therapists, doing everything they could at that point in time with the best supportive care that we had, because really early on we didn't have the antivirals and we didn't have the vaccines, but it was being there every day, giving that supportive care, doing what you needed to do, doing the most of what could be done to help improve that patient, get them better, and ultimately get them out of the hospital. But it was really that answer of, there's really not much that we can do other than be here for you, give you that oxygen, give you steroids if you need it, keep you comfortable.
And then you said it off the top of the program, was that 4 years can seem like a long way ago, but then you hear a story like that and it's very, very present. So what did you do for mental support, emotional support? Where did you turn?
You know, my life was quite a bit different than most people's, and we've talked about this and my colleagues. Yes, on the front lines, those people that were treating the majority of COVID patients day to day, it was stressful, and you saw the despair when there couldn't be much that was done. But we were still able to go to work every day. So I was really, really thankful for that fact that I could go to work every day. My life didn't necessarily change. A lot of healthcare workers didn't necessarily change, but I had everybody else I knew couldn't go to their jobs. They were stuck inside. So I was thankful for that fact. What did I do? You know, I drew comfort in understanding and realizing that this wasn't a time for my parents to be able to see me every day because I was on this show talking about this horrible disease. I would go home, I would spend a lot of time outside. We knew being outside was safe, so walking, especially in that spring and summer when COVID first hit and the lockdowns first came, and then just being with my children. But there was stress on that side too, understanding, do my children, have they been exposed? Do they have symptoms? Are my parents who are elderly, have they been exposed? You know, obviously there were lockdowns, but people were still getting exposed for one reason or another. So I think I was trying to just enjoy the present, enjoy talking with my loved ones, and really being outside, doing activity. Those things were really helping me get through.
Yeah, on a fun note, I remember some of our viewers would, write in and say they had a Doc Hawk sighting at the grocery store behind the mask or out at the park running around. So you were out there and doing the best you could, the way all of us were. So, Dr. Nawalnik, how might trauma for a frontline worker differ from maybe the trauma and isolation of someone who was told they had to stay home?
I mean, they're just very different experiences, and so the impacts are certainly going to look a little different. For the workers, there's that, immediate, experience of seeing the reality unfold in front of them. For the people at home, there was a whole different battle around credibility, because there was a certain mixed messaging out there in terms of both either politicization or just the media and online outlets, because when we're not out engaging in real time, now we have to turn to online engagement, and that makes us much more susceptible to spooky conspiracy theories and trying to undermine. So when we're talking about this collective trauma, I think it's also important to recognize that there was a little bit of complex trauma as well in terms of these multifaceted impacts that kind of kept occurring, whether it was just initially it was we'll hunker down for a couple weeks, then it turns into months, and then it's years, and that was kind of a big thing. And then also all the other geopolitical things that were going on at the same time, fear of scarcity, racial issues that were going on. There were just so, and then what do we do with the kids? I mean, there was just so many. It was like bam, bam, one after the next, and so you've got this collective. We're all going through it, and then you've got this complexity in terms of multiple impacts.
How soon we forget? As you started to list out those, I was thinking, oh, you're right. Yeah, I mean, you almost had to pick which part of this you're going to, like for me, it was, what are my kids going to do? Who's going to watch my kids while I'm working? Because, as Dr. Hawkinson was saying, a lot of us were considered, you got to, come in. You guys got to do a lot of your stuff online. Everything was just different.
Had to. Yeah.
Yeah, exactly.
Because I would never have done, virtual or online teletherapy if I didn't have to. And I still feel to this day that in the absence of any other means, it's a great alternative, but I think it falls far behind what the actual in-person therapeutic connection
Yeah,
is.
something that you said you never would have had to do, but we were able to reach some people maybe who would not have been able to come in.
Yeah, I don't want to discount that.
No, but there were just,
yeah.
again, some of those, people never like to hear the word silver linings, but it was one of those things that came up that we made the best of. So, Dr. Johnson, the pandemic, not the first instance, as we know, of collective trauma, because we think of examples like Hurricane Katrina, 9/11. Do you know how long of a tail, so to speak, these events have? How long lasting can the trauma be?
Yeah. And that's the million-dollar question, because for this collective trauma, not everyone's traumatized by it. And so with inherently in trauma, you think about someone that's in war, not everyone comes back with a diagnosis of acute stress or PTSD. So there are myriad of factors that impacts one's susceptibility to feeling trauma in a significant diagnostic way. So the tail for some may be days or weeks, and the tail for others will be years.
Well, it could be delayed trauma, if you will, right?
There's the idea that if you're surviving, you don't have time to feel the trauma. Right. But once I am done surviving, I can then feel it.
Any thoughts on how long these types of things last, Dr. Nawalny?
I think she nailed it, and it's one of those things also in terms of how psychologically minded are you, how insightful are you, and how willing and able are you to access, services, care, and support. Yeah. Because for some people, you can have two people that are struggling at a level of 10 out of 10, and one might have the, that flawed "I've got it" mentality and just try to white knuckle it and go on their own. Whereas somebody else is going to acknowledge, I'm at 10 out of 10, I need help, and then be able to reach out. And then we also go back to SES and availability and access. So many different factors that are going to shape that tail.
Whether it be post, pandemic trauma, how do we recognize that someone needs help as an adult? We'll talk about kids next, but as adults, how do we notice among our colleagues and friends?
Typically it's the big warning signs are if you're not enjoying or engaging in activities that you used to really find pleasant and enjoyable, that's a big red flag. How are you sleeping? How are you eating? Are you tearful random times of the day for no real reason? Is the anxiety sort of to a debilitating state that now you're not even afraid of a specific thing, you're more afraid of the anxiety, and so it's on this kind of perpetuating self-fueling cycle. So all these things together are going to be the kind of big flags. If you start having to miss work because you just feel too overwhelmed to go, if your relationships are going downhill, substance abuse spikes, all these things are kind of the yellow brick road to problems.
Did the pandemic help bring mental health to light as far as people feeling more comfortable talking about it, because so many of us had issues with it?
Yeah, and I think that when we look at data points like this study that we're talking about this morning, a lot of that is because people it brought mental health conversations to the forefront, whereas in the past they were kind of this speakeasy thing that I'm fine, I don't know how you are, and so being able to see people that we look up to, celebrities or just friends and community leaders acknowledging we're in trouble and there's a lot of issues, people are hurting, that it kind of normalized it. So in a way, another silver lining, if we want to use that again, but that people were able to have conversations around mental health and wellness, and it didn't have to hide.
How do we recognize it in kids? How do we know to recognize this in our children?
Pretty similarly, actually, to what adults will experience. And so we see a change in their personality, or we can see a change in personality. So a typically happy, pretty boisterous kid is now cantankerous, irritable, easily frustrated, or quite tearful. We will see increase in anxiety and fear. So the kid that's, again, goes and runs and plays is now scared to leave trusted adults. Changes in sleep, appetite, changes in their grades. So for a parent, that can be a quick warning sign, is that my typically studious kid is no longer engaging academically. They're not really getting up to go to school, or they're at school, but they're not. The teacher's letting us know they're not really engaged. So we see these changes in their functioning that lets us know that symptoms have kind of increased and met a threshold that we need to rally support.
So do we process this trauma collectively or individually?
Yes.
Yes and yes.
I mean, really, it's, when we think about collective trauma, and this is where the pandemic was kind of particularly difficult again, there's oftentimes you'll see a shift, like there will be some purpose or meaning that kind of drives us to come out of it. Like with 9/11, we saw a lot of, kind of the binding together of people against this terrible threat that had occurred and loss of life. And so it became kind of this rallying, unifying cry. COVID was the exact opposite. It became this extremes, divisive, corrosive at times, and just the whole backdrop, it just started to feel kind of really alienating, and it kept people really on edge in terms of if somebody just showed up somewhere with a mask on, that would be enough to initiate some sort of an argument, or people looking at you going, oh, because they became kind of political statements. Sure. And it was just really unfortunate that we didn't have the ability to really come together in the way that we should have, to recognize that this was a significant enemy, and that's just something I think will be lost. And I hope that at some point we're able to learn from it and grow. But it's rough.
Well, if you have any questions, or maybe you have a story that you'd like to share about how you cope with stress now and then, you can use the chat on YouTube or Facebook. You can tweet us or email the Medical News Network. Information is right there on your screen. Let's get back out to Dr. Dana Hawkinson for our COVID count this morning.
Yeah, so overall, the COVID count has been really good compared to the winter of 2020, 2021, and 2022. Right now in the hospital, we only have 12 inpatients, no severe illness in the ICU or on the ventilator. So our numbers for hospitalized COVID patients are going down. That is always a good thing. And hopefully we can continue to see that downward trend.
So some good news, though, on the RSV front. A new study shows the recently released infant immunization does a great job at keeping babies out of the hospital. Technically, this is not a vaccine. It's a monoclonal antibody. It was just recently recommended by the CDC last August. So, Hawk, remind us, who is this for, and how did they prove that this was effective?
Yeah, this is for infants in their first RSV season. So obviously, if they were born in that middle part of the year, as we get into respiratory viral season, it is going to be for those youngest children to help protect them against RSV. Again, just as you said, it is a monoclonal antibody, and it's an injection, and you give it to those infants in their first RSV season. What the results are from those patients that did get this drug are astounding. 90% reduction in hospitalization for RSV infection in those youngest, those most vulnerable at-risk patients. It's just astounding. Again, science and medicine, you have people who have dedicated their lives to researching, doing it properly, evaluating the safety and, of course, efficacy of these drugs. This is one of those such drugs to protect the most vulnerable population against a specific disease. And it has worked and has shown astounding results to help reduce the chance of those very young babies from going to the hospital should they be infected with RSV.
Hawk, thanks so much for the update this morning from Olathe. Let's get to some questions and comments from our viewers this morning. And Joellen, a very long-time viewer of our program, says she will never forget those stories that we shared here on our program. Also, Cindy just shared that this whole experience has given her PTSD. She lost her father at the beginning of COVID. Shall we never forget the people who were lost? Consider yourself lucky if you didn't know someone who lost their life, or it was a really, really tough time. Jean asks, do you agree that many couples' relationships were affected adversely by this, with disagreements under the house about how social to be, and that you got politics involved? I'm sure you have a lot to say about that.
Who, me?
Yeah. What?
Yeah, there was a lot of impact. Also, when you think about a marriage, if you've got even one half of them working out of the house, that's time apart. Absence makes the heart grow fonder.
It certainly does.
When you spend all of this time together under the same roof, there's going to be some stress cracks that are likely to form. And then when things started to open, the comfort level of one half of the couple versus the other, it was just kind of ripe for disaster. And so, for people that had good, effective, open lines of communication, they, I think, fared relatively well. For those who did not, and had maybe had a lot of things they were hiding, or different, behavioral things, substance abuse certainly could be one that drives a nice wedge. And social media diving in as maybe you've got two different algorithms in the household,
Right.
feeding different information to either side, and neither one is receptive to the other. Yeah, I think it goes without saying there are going to be a lot.
Quite a stress test for any marriage, a pandemic. And on the same note, though, with children, I mean, we see the stress among parents. How was that filtered down to our children? How did that play out under the roof?
I think it was a bidirectional stress communication because kids were also stressed inherently, not being in school, not having full access to their friends. If you had a pod, you were great because you had a few friends you could hang out with, but not every kid had access to a pod of friends to hang out with. And if they made a poor choice at home, they often lost their means of communication to their friends during that time. So for most parents, the carrot is the phone or whatever device they're using to communicate. So we had stress from kids going up. If they were struggling academically, that went up to parents, and then we had stress from parents also going down to kids. So I think it was probably more than bidirectional. It was probably multilateral stress circles going around between within families. And then when kids were at school and if parents were working from home, you had kids that needed to be quiet so parents could work, but the kids also needed help from schooling purposes as well.
I remember the days and handing off a device
yes,
just to keep them quiet so you could make a call.
Yeah, and so especially for those younger kids, they had no idea what they're doing anyway. So it was, and I think there again for families that didn't have good communication skills, we're still feeling the impact of this 4 years later. This was not a time limited, discrete thing that happened. It is still happening.
I was just saying, as we're talking about this, I mean, we talk about collective trauma. These are things that we've kind of put out of our minds, haven't really dealt with, and so to discuss this now, like it takes you back and it kind of uncovers and opens that scab that is actually a lot thinner, I think, than we might wish or hope that it was. So, something to be aware of.
Oh, lots to take away from this past 4 years and this morning. Dr. Hawkinson, I want to start with you. You've been here 4 years, every single day, sharing all sorts of information, and we certainly appreciate that. So just what's the big takeaway? 4 years past this pandemic or into this pandemic, however you want to say it. What do you want folks to know?
Gosh, there is so much. Obviously, we don't have time to talk about it. I just would like to talk about, we saw this pandemic expose or make more obvious the health inequities and the disparities between populations. And I think we need to address those things head on. We also saw a collective of increased disinformation and misinformation, particularly in the medical and science and public health realm. And staying in my lane, I think we need to address that. And I think, unfortunately, it started from the top down with ivermectin or ultraviolet light or bleach, or the vaccines are putting microchips in you. And I think we have to understand that people in public health and people in medicine, we are just here to help you and your family, help our communities. And I think having that disinformation is extremely important, an extremely important topic that we need to be fighting every day. We saw this as we are kind of going backward now, as we are not wanting to vaccinate ourselves and our children. We've seen this with outbreaks of measles and decreased vaccination rates around the country. We have these very simple, safe, proven methods to help protect us and our families from these diseases. We need to continue to support those types of measures. We need to continue to support our public health agencies and our public health workers, because that is truly what will make our families better. Keeping everybody healthy, that is what will make our communities better. Having productive workers where people can go to work, they can earn money for childcare, they can be out there in the community providing a service. It is proven that when you have productive societies and healthy people, overall, everybody does better. So I think we need to continue to combat that misinformation and disinformation, particularly in science and medicine. We, and I'll say we as the collective of healthcare and public health, have dedicated our lives to helping keep you and our community healthy. We want to continue to do that, and we need to continue to fight that misinformation and disinformation on a daily basis. I think it was just one more outlet for people to take out their anger about the overall situation. It was an easy target. But we know what helps people. We are here. We have our scientists, our medical providers, our public health providers, just wanting to keep you as an individual, you as a family, and our whole community safe so that everybody can prosper. And so I think that is going to be my biggest message today.
Huck, thank you so much. Dr. Johnson, what's the takeaway?
From the APA study, we know that stress is there and stress is real for both adults and kids. So I really encourage everyone to have open communication. When I ask someone if you're okay, how you doing, go ahead and tell me. How you actually are doing, yeah. How about we take that opportunity to actually tell people that we trust and love how we're actually doing.
I like that. All right, Dr. Nawalik, what's the big takeaway today?
Number one, I think that being 4 years out from this thing, I just want to emphasize that if you're still with us, whether you've had losses or stresses or changes in your life that have been difficult, take some stock in that, the fact that you are still here and that you are the reason that you're still here. Give yourself that credit and accept that this has been a hard road, but that you've made it here. And that means that there's still hope to continue to progress from there. Also, going back to the silver linings, some of those silver linings, for me, it's having the ability to ever come here and meet you guys and Hawk and everybody, and this has been fun, and it's been kind of a cool little thing. But when we think about the tele-platform, I think that a lot of the reason that we're seeing so much burnout and so much stress and so much anxiety is that things that could have been emails are now becoming the ever-present Zoom meeting that we can jump on at any given moment. And we're seeing meetings get scheduled over lunch hours, after work, before work. It's just it's eroding that healthy boundary that we have to have between our personal life and our professional life. And I think that I would hope that all employers could start to be maybe a little more respectful of, if you didn't have meetings, let's just get back to being a little more efficient, I guess, in how we do things so that we can preserve each other's time, energy, and mental health and well-being.
Really well said. Thank you both for being here. A couple more quick comments. Joellen says yes to science, and Carolyn just said so grateful for you guys, and of course we're grateful for all of our viewers who have come to see us for the last 4 years, and we're very, very grateful for you. Again, thanks to these guys today. Thanks to all of you for being with us today. We'll see you back here tomorrow. Coming up tomorrow on the Morning Medical Update. Imagine a constant thumping in your ears, a whooshing noise every time your heart beats. That is pulsatile tinnitus, and it can drive you crazy. I'm Jessica Lovell on the next Morning Medical Update, the new surgical option that can cure the condition. Hear from 2 patients who had no other treatment until now. Tuesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.